Is there an effective home remedy for a UTI? MAKEBA, how you doing, darling? No, there's no home remedy for it. Once you have a UTI, it's going to have to be treated usually with an antibiotic, of course, and there are ranges of antibiotics. There are some mild ones, some that are kind of strong, and some that are really strong. And so it just depends. But preventing a urinary tract infection, that's another deal. And so once again, I think that the probiotics are good with that because they help maintain a normal bacterial count in your private areas, your female areas, because oftentimes a urinary tract infection is caused by bacteria that are outside the vagina and the urethra where you urinate from. And one thing about intercourse will push those germs into a place that they normally aren't. And that's why when you have intercourse, it's very important that you empty your bladder immediately. So it changes the whole mood. You have to get up, go to the bathroom, empty your bladder. So I will often say when this happens, drink water before a sexual intercourse. And by the time you complete the act, your bladder should be full and you should be ready to empty your bladder. That will help blow out any germs that have been pushed up into the urethra. And then things like cranberry juice. And they have cranberry extract capsules that you can take, or you can just drink cranberry. What cranberry does is it makes an unfavorable environment inside the entire urinary tract. That's from the kidneys, the ureters, which connect the kidneys to the bladder and the urethra, which is the tube that you urinate out of. In a woman, it's about an inch long. In a man, it's as long as his penis is long. So that's why men don't usually get urinary tract infections from intercourse, because even if they get bacteria, they're only in the distal portion of the urethra of the penis. And when they ejaculate or urinate, they blow all of that out and it's not a problem. Whereas women, it's a very short distance. And oftentimes, you know, when mother tells you to wipe from front to back, that's very serious, because when you wipe from back to front, you're bringing bacteria from the rectum, and the rectum and the vagina are only like this far apart to the front, and that will infect. It can cause a urinary tract infection. The vast majority of UTIs are directly because of E. coli that's coming from the patient's own rectum. That's the most common bacterial pathogen in a urinary tract infection. There are others, but E. coli is the most common, and one that you've all heard about. You hear about E. coli in lettuce coming from farms where they're contaminated with feces. E. coli is just one of those bacteria that it's in everybody's body, and when it stays where it's supposed to stay, in your rectum, in your large intestines, it doesn't bother you and you don't bother it. But and females in particular are very susceptible to infections, urinary tract infections in particular, because of that relationship. If you have, you know, if you have extra skin down there, or you perspire a lot, you're wearing panties, the panties get wet, they cause a direct line from the rectum to the vagina and the urethral orifice, and can contaminate you that way. So very important that we maintain good hygiene down there, that we wipe from front to back. And we can use, I really like the baby wipe types of things, not just dry tissue. Dry tissue does a halfway decent job, but not a good job. And there are baby wipes that will totally eradicate bacteria when doing so. And I also recommend that you use them post intercourse. Very good for a quick cleanup. Then you can get up and take a shower, or just keep a soapy wet washcloth right by the nightstand, so you don't have to blow the whole mood by getting up, cleaning up immediately. That's just kind of like you're rejecting your partner. So you don't have to do that, but you can do and take care of the amount of stimulation that we're talking about. Okay, great question.